Hi, everyone. Welcome to the webinar. My name is Ben Eveslage with FHI 360. Let me do a quick audio check. Can anyone hear me? If you can, give a message in the chat. Great. Okay, people are joining. Let's take just a couple minutes for people to join. It's already at the top of the hour, so just a few moments, and then we will start. All right, let's get started. Welcome to the how-to webinar on setting up and using QuickRes. Hello, my name is Ben Eveslage. I'm a technical advisor for online HIV services at FHI 360. I support our global and bilateral HIV programs, mainly funded by USAID and PEPFAR, to utilize online and virtual platforms to support HIV outreach, referrals, clinic reporting, and case management. So let's start with some logistics. We'll go to the next slide. So please keep yourself on mute. I believe everyone's muted by default, and you can ask questions at any time. I think what we can start by doing is just give a quick intro, your name, title, organization, country in the chat, and you can say to all panelists and attendees. So it can be shown to everyone, just to get a sense of who's on the call. And you can use the Q&A feature, which is a separate feature than the chat, to ask questions anytime. And we have several moderators who will answer in real time, and we can also answer those questions live during the open Q&A session. So be sure when you're in your Zoom, you can go to Q&A. Sometimes it's under More and Q&A, or there's Q&A at the very top for my phone, and that's where you can add your questions. Also, during this Zoom, we will use polls, so be prepared to click or touch options on your screen to select an option. Next slide. So today we will review how HIV programs can join QuickRes for online HIV service, booking, and case management. The intended audience for this webinar includes HIV program staff, donors, and implementers who are interested to learn about ways to leverage online and virtual platforms to support HIV service delivery. So if other folks are on the call that are working in other disease areas or health areas, they might still find this webinar useful. However, the technologies that we're discussing were specifically adapted for the HIV programs, so they might need to be adapted again for other purposes. The objective of this webinar is to support any or all HIV programs to consider how to join and use QuickRes, including USAID and PEPFAR-supported HIV projects, but also those implemented by the Global Fund or other donors and government-supported HIV services. So while the focus is on QuickRes specifically, we also hope that our attendees can learn from QuickRes to improve or design their own systems if QuickRes isn't an option for them. And also we want to learn from others on this call. There's other organizations that have similar expertise and systems, so you can feel free to share related resources and perspectives in the chat. So go to the next slide. So today we have 90 minutes scheduled. We may not need to reach the entire 90 minutes, and our learning objectives are really built into our agenda. We'll take 5 minutes to set the stage for this webinar, which we're doing now. Then we'll have another 5 minutes to give you a background on QuickRes, and shortly we'll give you a hands-on experience with the actual tool itself. Then we'll jump into a review of the main features of QuickRes, and you can determine which of these features you want to have demonstrated live during the webinar. And then we'll have time for open Q&A to ensure all participants understand the core functions. And then we'll move to review some of the considerations for joining QuickRes and its setup and rollout steps. And then we'll conclude with some light action planning and Q&A to clear up any remaining issues before closing. Next slide. So a little bit about your hosts. This webinar is brought to you by the USAID and PEPFAR funded EPIC and Linkages projects. These projects are implemented by FHI 360 and now span around 40 countries across the Caribbean, Africa, MENA, and Asia regions. Next slide. So within FHI 360, we have a Going Online portfolio. That's what it's called, Going Online. And this supports our global and bilateral HIV projects to leverage online and virtual platforms to support HIV service delivery. So over the past 4 months, online and virtual platforms have become critical channels for supporting continuation of HIV services during the COVID-19 pandemic, because it's greatly impacted our traditional service delivery approaches due to physical distancing and clinic capacity issues. But regardless of the pandemic, it's time HIV programs really shift to connecting with more of the target audience online. And in many countries, there are more mobile number subscriptions than people. And as of 2020, this year, 59% of people globally are internet users and nearly 50% are social media users. So recognizing these trends, we developed the Going Online framework several years back, which you can see here. I think, Sarah, you can click once. You can see the framework here. And it shows the activities along the cascade that can be used to support HIV programs to reach and engage their target audiences online. And this includes opening up new self-care options for accessing HIV services. So I invite you to find the Going Online vision, which is the seminal document of this approach, online. And it has an overall summary of how HIV programs can go online. And it sets the context for today's webinar topic. And you can find this and related documents at fhi360.org/goingonline, and that's the link at the bottom of each of the slides. Let's go to the next slide. So this is part of a 5-part webinar series. We already had one in May, co-hosted with the Prep Learning Network and PATH, and that was focusing on PrEP, service delivery online. The materials are linked on the bottom of this slide, and we have 3 upcoming webinars that'll focus on different topics. When you receive the slides, you can click the date to actually register for those webinars. We'll go to the next slide. So let's start with some background on QuickRes. So let's go to the next slide, thank you. QuickRes is based on the Online Reservation App, or ORA for short, which is a software originally developed in Thailand by FHI 360 to help track the results of online campaigns for uptake of HIV services. We'll go to the next slide. So ORA, the Online Reservation Application, now exists in 12 countries. And at several junctures, we added new features to ORA to make it more useful for HIV programs and also to meet their unique needs. Once a new ORA version was launched, other countries could benefit from this because they could copy that platform and just adapt the brand, the language, and the clinics and services and host it on their own server. So you see here, there are several different builds or versions of ORA that were launched, and then many countries actually copied those. For instance, Yes for Me in India, which is now implemented by JHU's Accelerate project, was also copied over into Sri Lanka. And in the Step 1 platform in Kenya, which has more features, was copied over and used in Cambodia, Botswana, Eswatini, and Mali. More recently, we upgraded again to have more comprehensive case management features and SMS blast function coded screening in Jamaica, which is quickly cloned, and a multi-country capacity was added to make QuickRes. So QuickRes is built on the ORA application. What's unique about QuickRes is that the site will actually sniff the location of users, clients, and present to them the website with relevant country-specific languages, information, clinics, and services. And on the back end, users that log in are assigned to a country-level access, and therefore they will not see data or client information from HIV programs in other countries. So that's what makes QuickRes unique, is that it is a multi-country platform. So moving forward, we have some planned upgrades to QuickRes already, which will also be then applied to the most recent ORA builds as well, and then upgraded for several of those countries using their own ORA. So go to the next slide. So now we have a time to actually try it out ourselves. So what we'll do now is we'll go, before we start, I will say that we need to disclose a few things. The QuickRes website is online. It was put online earlier this week for testing, and we're still finding bugs. So we did try the client-facing functions, which we are going to actually try out now, and they should work correctly. However, don't be alarmed if there are issues. You can always mention something in the chat if you're having a challenge. And we can always switch to an existing Aura platform to demonstrate these functions if QuickRes is having some challenges. So we'll go to the next slide. And this is a time for you to actually try it out yourself. We're not going to demonstrate it. We're actually going to ask you to use your phone, open the browser, and try it out yourself. What you'll be doing is going to quickres.org/100, or you can just go to quickres.org. Doing /100 will automatically put you into the test country version of the website, where you can do the pre-testing. So please now, if you're on the computer or a laptop, open a browser and go to quickres.org. Okay. So once you're there, what I'm going to do is I'm going to add this link in the chat, and you can also click on it there. Open the link. It'll take you to a page that looks something like what you see on the screen, and it has a couple countries. One will be QuickRes testing, which is the country which you can select. You can also select Lesotho or Guyana, which are countries that are planning to use QuickRes quite soon, so they added some of their clinics on there. And the other one, which is in Thai, is Thailand. It's a redirect. So it actually doesn't exist on QuickRes, but it will send you to the existing platform in Thailand. So for this purpose, let's go ahead and choose Guyana, Lesotho, or test QuickRes. You can go ahead and do that, and it'll take you to the welcome screen for that country. And you can go ahead and press start to see your options. And this is what clients are actually seeing. So you're going to go ahead and pretend that you are a client, you're interested in HID services, and you can go ahead and start. I would recommend by doing one of two things. You can immediately book for an HIV service. I would choose something simple like HIV testing or STI testing. And it can try out the risk assessment. The risk assessment will take a little bit more time, but it'll show you how clients can use QuickRes to understand their risk and to receive tailored service recommendations instead of seeing the full list, which you see on that first page. So go ahead and choose one or the other, book a service immediately or do the risk assessment. And while you do that, you should be starting now. While you do that, you can note any questions you have in the chat, or you can note any issues you're experiencing. But we'll take a few minutes. Please go ahead and commence with the risk assessment and the appointment booking. When you're finished with booking an appointment at one of the clinics, just say done in the chat, so we know when people are just about wrapping up that demonstration. And on the booking, enter a fake phone number. It'll tell you how many digits should be the phone number. Enter 8 or 10 or 9 digits, and then also you can enter a fake name, whatever name you like it as the booking name. When you do the risk assessment, you don't need to give your honest answers. You can give hypothetical answers. And if you skip the risk assessment, some demographics are asked on the booking confirmation page. All right, so please go ahead. If you're nearly completed, that's great. If you do complete and you get to the confirmation page that your booking was received, just write done in the chat. We'll take our time here while we do the risk assessment and appointment booking. I'm not going to be demonstrating it live right now. I'd like people to do it on their own. So as we do this, I'll wait for your confirmation that you're able to finish. Great. Some people are able to finish. We'll wait a little bit longer for some people to complete. Great. This is really great news. So this is just an example. If you do run into any issues or if it's not working, please do write a message. But so far, this is a great example. We have 79, 80 people on the call, maybe 40 people at the same time are booking, and it seems like people are able to proceed through the website. So that's a really good sign. It can handle some higher volume of use and can probably handle a lot higher. Great. So people are completing the booking. Any issues with it, please do mention it in the chat. So we'll go to the next slide. So let's go to the next slide. All right, so let's just do a quick emotional reaction to your experience using QuickRes. I'm glad that it seemed to work for most people. We're gonna do a poll, and I'll ask Sarah to pull up the poll right now. And we're gonna ask this question: what was your immediate reaction, even right now, after using QuickRes? And it would give us some options here. Choose the one that strikes you. You only can choose one. So this will just be illustrative and will help us guide the discussion as we move forward. Just choose one and take your moment now to go ahead and choose. Okay. All right, so Sarah, you're managing the poll. I'm not sure if you're able to see responses or if we're able to present the results right now. Let's see how this works. Okay, great. So it looks like we do have some great responses already coming in, and people are mostly just interested to know more. Okay, no one's in the wrong webinar, so that's good. We're all in the right place. And looks like we had one person that might have had an error. So if you can describe the error, you can go ahead and put it in the chat or even in the Q&A, just so we can keep track of that. Some people are worried or nervous. That's totally understandable. This is a new kind of system, and it does entail new aspects of data security and things that we will review today. We're sorry if you're confused about how it works, but we will explain more. That's why we have this webinar. Some people already love it, so that's a great sign. Great. So let's go ahead to the next slide. So now that you've gotten to try it out, let's review the functions in more detail. Hopefully this will address any of your confusions. Next slide. So we have 8 functions that we wanted to highlight today. We can go into more detail and on any of these and do demonstrations of how it works on QuickRes. We'll go to the next slide. So this is what you just did. QuickRes allows clients to assess their own HIV risk, receive tailored service recommendations, and book appointments across partner clinics all on their own. Outreach and clinic staff can also book appointments on behalf of clients if clients don't have a mobile phone or smartphone, or if they just want assistance. So this is an entirely online process of outreach to arrival at clinics that does not require filling or passing of paper forms and referral slips. We'll go to the next slide. So QuickRes also allows a program to use any number of online demand generation campaigns and track their results separately using codes embedded in the links that clients click to arrive on the QuickRes platform. So these codes also allows for client-led referrals, such as for tracked index testing. You can see it here on the video that's being played on the right-hand side, that once you're on the back end, you can actually go to offer online referrals for index testing by entering the phone numbers of the referred partners there, that they then get sent an SMS with a link to book an appointment back on the same platform, and it's tracked from index case to referred partner. We'll go to the next slide. Okay. So clinics and program staff can view upcoming appointments and they can plan accordingly. So they can use this for scheduling their clinic hours, spacing out appointments so that it is in accordance with physical distancing measures or reducing the number of people in a clinic setting. And they can also use this to call clients before their appointment to confirm or to give them any information that's relevant for accessing services. We also, as you might have seen, before actually booking, there is a COVID screening, a self-screening. And if you show any risk, it will limit you from being able to book at a physical clinic, but you can then book a virtual consultation or home delivery. If you don't show any risk, it'll let you continue. We'll go to the next slide. QuickRes also allows clinics to view all their upcoming appointments and report when clients arrive. You can see here the screenshot that says the Arrive button. Once that's clicked, it opens up the other reporting options. And these are many of the standard HE services that would be provided anyway. And this allows for reporting of those services that are provided during that clinic appointment. And the benefit of this is that it really does close a monitoring loop from the original outreach online to what happened in the clinic. We'll go to the next slide. Case managers can view clients that are assigned to them through their own login, and they can easily filter between clients on PrEP and ART. They can report retention, multi-month dispensing, viral load test results, and detailed case notes. So you can see this sort of being done on the demo the video demo that's being played right now. We'll go to the next slide. A new feature we've just added is the ability to send SMS blasts to whole cohorts of clients. And because it can estimate the number of clients in each of the cohorts that you select, you can see here there's a drop down for ART clients at all clinics. You can actually segment this to be all women, such as if you're advertising a certain family planning service that's new. And then it will estimate the cost roughly to send all those messages, because this is linked to an SMS gateway that you need to load your sort of credits on in order to send these messages, and it has a cost per SMS sent. So it's going to calculate that for you and show you how much it's going to cost. This is a great way to stay in contact with certain cohorts of clients around clinic changes, hour changes, new services that are offered. When you roll out PrEP, for instance, or HIV self-testing, it's a great way to update them on that option and ask them to book a new appointment or call to get them help to book an appointment. Next slide. So you can also easily view results on 4 live data visualizations on Aura. This includes an overall cascade. It does go from risk assessments completed all the way through to ART linkage. It doesn't get into retention on that particular cascade, but you can export the data and view that separately. We also have a timeline view, so you can really see your performance each week or month or quarter, and see where your programs stand there. You also have the ability to compare between several approaches, and it's a pretty sophisticated way of doing this. We use tokens in the outreach approaches, so there's a specific code assigned to each outreach worker when they book appointments in the system, and each online ad or influencer or other method, and those tokens can be used and labeled in a way where you can enter a certain label into the search column for the graph, and it'll show you the results of that particular approach. So if you type in Facebook into the approach, it'll give you all results from your campaigns on Facebook, because you've programmed that term into all of your tokens that are being used to promote services on Facebook. And you can also do it by partner. So you can use that compare visualization to easily put in the name of each of the organizations, and it'll spit out a side-by-side comparison of many factors along that cascade between your partners. The last one is a table view. The table view has a lot more data, and you can have a lot more tokens you can enter. So you can maybe enter a whole cohort of 30 outreach workers and compare all of their results. Okay, so we'll go to the next slide. Okay. So this last slide here is just demonstrating that we did add many safer user functions on Aura and QuickRes. So of course, there are login IDs that have very specified user permissions. So as a case manager, you obviously can't see everything, and as a clinic staff, you obviously can't see everything. It's really tailored to the user. There's limited identifying information that's even captured on Aura. You did notice that a phone number is captured. That is the main UIC that is used, and it's how clients are followed up and being sent SMS reminders about their appointment. The name is considered a nickname. And as you can see here, when a case manager or clinic logs in, the phone numbers aren't presented. You actually have to hover over it to access the phone number. Alternatively, you can enter their WhatsApp number, and then a WhatsApp icon shows up that opens up the chat, but it's not like you can screenshot all the names and all the phone numbers. That's not possible. And on the data export, all identifying information is removed. So the phone number is not included in the data export we're using it for reporting. All right, we'll go to the next slide. All right, so we're going to do another poll, and this is basically to ask you, which of these 8 features are you interested to have demonstrated live on Aura? So we'll open up the poll now, give you a moment to review the ones. Again, just choose your top option. You can only choose one option, and we're gonna prioritize which ones are the most popular. And given our time, we might be able to do all of them, but we're gonna prioritize them in the list of most to least popular. So the options again, if you want us to do a video demonstration of how to do the risk assessment, what it looks like in appointment booking, which you've done, but we can do it again, you can click that. If you want more information on tracked referrals, how the tokens work, how clients can refer other clients and have it tracked, such as index testing or an enhanced peer outreach approach, which we can discuss more in detail. If you want to know how clinics or staff can view upcoming appointments and provide pre-appointment support to clients, there's an option. If you want to understand the clinic reporting options, what are they able to report on in QuickRes, you can select that. If you want to know what case managers can do for reporting, including following up on long-term clients, such as those enrolled in ART or PrEP, you can click Virtual Case Management. If you want to see the SMS blast feature in more detail, we can do that. If you want to look at the data visualizations and understand how to export data and use data, you can select Management and Data Analysis. And if you want more information on the safer user features that I mentioned, you can select that function. So go ahead and make your selection. And in just a moment, we'll review the results and we'll start the demonstrations. Yeah. So I see there's already a question about tokens from Mary on the Q&A. So I do believe that's something we can address in the demonstrations. All right. So Sarah, why don't you reveal the results of the poll so we can move ahead with the demos. Okay, great. I do apologize. I believe that some users that are using Zoom of earlier version might not have access to see these polls or be able to interact. So I'll just mention really quickly. Our top result is virtual case management. And then we have tracked referrals. So in tracked referrals, we'll talk about the tokens and tracking from client referral to their referred partner and their results. And then the next is the client-led risk assessment. And then we have the other ones coming in later. So this is great. No one wants to know about the safer user features. However, there is a guide that we will send at the end of the webinar that has this described in more detail, so you can always see that. Because there are enough people that want the risk assessment and the appointment booking, I will do that first very quickly, just because that sets the stage for the rest of them. I'm going to go ahead and share my screen so you can see what this process looks like. Okay, so Sarah does say that you'll need to stop the sharing for me to start. Okay, great. So I'm going to share my screen. Share. Okay, so I'm going to go on to QuickRes and book an appointment. Okay. So let's go ahead and get started. What I'm going to do is I'm going to choose Test QuickRes, and I'm going to start. I'll do the risk assessment to take you through it. It does say date of birth, so I'm going to not reveal my real birth date. When was your last HIV test? Okay. I'll let you know when things actually impact the risk result page. So HIV status does impact the risk result page. Let's go ahead and say negative. Let's use a very common case for our programs. This does impact the risk result page because this can let the program know if the client is might be at risk for another STI, but maybe not HIV because they're taking PrEP. Let's say that I take PrEP not every day. And this is to know whether they're taking PrEP through their access to a doctor or they're getting it somewhere else. So let's say that I don't meet with a doctor, I'm getting it elsewhere. Okay, how to identify my gender? Let's say male, sex assigned at birth, male. Who do you have sex with? So sex with and gender don't impact the risk result page. They can impact the risk value calculation, which is a feature I can show you in a moment. Because if you're a key population or populations that experience higher burden of HIV or stigma discrimination, you can assign a value that your risk should be multiplied by. The real risk is here is exposures to HIV. And so let's say sex without a condom or condom broke. And then these are other risk multipliers. So if you never had exposure to HIV, you can have all these selected and it'll actually say you're not at risk because you need to have an exposure. And then these things will elevate the risk. So that's how it works. Let's say STI symptoms. We can also say multiple sexual partners. And let's do sex without my consent. There's also a separate one for physical, emotional, or economic violence. Let's go ahead and continue. So this says time to act. It doesn't recommend HIV testing because I did say that I was on PrEP, but it says you might have exposed to STIs. So it really does focus on STIs. Other things it says, it does say to continue taking PrEP and enroll with a PrEP doctor, because I did mention that I'm not really meeting with a doctor to manage my PrEP use side effects and my screenings. So it will give that. There are 17 possible result pages based on, it's based on HIV status, it's based on PrEP use and or viral load suppression and ART use, and exposures to HIV. Okay, so let's go ahead and book something that it's recommending for me. Let's do STI testing. COVID screenings here. So if you have any of these that you say yes to, it'll limit you from actually booking at a physical clinic. But let's go ahead and let's look at a clinic that we have options to book at. Let's do the Blue Spot Health Center. These are programmed by the clinic on what they can offer. So these are 15-minute, these look like these are 15-minute appointments. And you can change it to be 30-minute or 1 hour or 2 hour appointments if you don't want many people coming in. You can also enter your own custom holidays. And clients that want to book for refill in months in the future, they can go down and select here from dates far in the future. So let's book something for Thursday, next Thursday, 1:15 p.m. These are all the services that are programmed for this clinic to offer. These are the standard list. And you can enter the cost for each service per clinic, and it will calculate at the bottom. So currently these are all free, but if they're not, if there's a private sector collaboration, you can add them there. You add a name or nickname, and you'll need to enter a phone number or just any numbers that add up to the 10 digits. Because I did the risk assessment, it's just going to ask me these questions. If I skip the risk assessment, it'll add questions here around key population status and gender and age for reporting purposes, which clients can decide not to disclose certain things like key population status. So let's go ahead and respond on those and submit. All right, so here's the confirmation for me. Also, if I entered a real phone number, it would actually send a confirmation by SMS to my phone as well. It gives you additional information about the clinic. It'll show you the clinic on a map. If you use a drop-in center, that is a key population specific drop-in center, and it's in a country where it might be stigmatizing or risking safety to put the actual location, what we do is we don't include a map, we don't include the address, and we merely say, please wait for a call from the drop-in center to confirm your appointment and give you the location. And then it's up to the drop-in center to confirm that the person who booked is a member of the population and that it's safe to give them that information. All right, so that's the process of the risk assessment and appointment booking. The token that was used today was 100. And on QuickRes, 100 refers to the country. So the first 3 digits are the country. And then after those digits, you can program new tokens to say 101. And 101 is 1001 is going to actually have a different purpose. It'll go to the same country, which is 100, and then the purpose will be 1. So the purpose can be many, many things, and you can define it on your own. And what I'll do is I'll just move right into the token description of how the tokens work. So I'm going to go into the back end as a super admin, which allows me to see all countries. Okay. And I'm going to go to tokens to show you what this looks like. These are the tokens. These are automatically created when you add a new country. These are the token prefix. So every Lesotho token will start with 266, which is also the phone calling code. So it's easy to remember. And then what they can do is add a new code. Let's start here. And let's say Thailand, I believe, is code 66. So it's 066. And let's add 2. And then for 0662, let's say this is Thailand outreach worker Paul. Okay. And then the purpose, you would use whatever categories you want to categorize data that comes from this booking code. So you would say, what we typically do is we give it a category of network. You see here network, which means social network outreach. When it's person-based outreach. It's not an ad. Okay, so that's one category. The next is outreach worker. The next might be the CSO name. So we can say, let's just say CSO for now. And then we can put the district and say Bangkok. KP type is if they have a specific key population that they reach out to or audience. So we can say adolescent girls and young women. And the ORW name, the outreach worker name, Paul. And you end typically with a token number. So 0662. Country, Thailand. We don't need this there. It can be programmed to present the website in a certain language. You can also, in your token, you can have it assign the case to a specific outreach worker and a specific case manager. So this is very useful when outreach workers or people are doing promotions online. This outreach worker will basically do a promotion like this. They will say, hey, friend, you can book appointments online, book with my token, and I can help you access services. They book like this. If you can see in the screen, quickres.org/0662, that's Paul's code. So when you go there, I didn't actually save the token yet, so it's not going to be assigning the case to me yet, but that's how it will work. It will, let's go ahead and save it. And let's do it again. And it should automatically direct to Thailand. Okay, let's go ahead and go to Thailand. Oh, that's right, we won't go to Thailand. Thailand's not the country on QuickRes. So so that's how the tokens work. And as an example, I will show you on an existing or a platform that has actual real data in it, how this is used for visualizing the results. So I'm going to go to the tokens. These are tokens for ibadan.com, which is an Aura platform used in Mali. You can see here, these are each of the peer educators, their name, their token numbers, 5. And you see here all the ways you can categorize the results. So you see here that they have peer educator online, and then they have peer educator. So let's just give an example. We want to do a data visualization. Let's try the Cascade version. This is showing you all the results from Ibadan. They just started a few months ago, okay? So you can segment by date, and then you can use this here. So you see all those terms that we had in the token purpose field. Let's say that we only want to view the results for this outreach worker. Her name was Aminata. Her code was 0004. So let's go ahead and see if she has any. She doesn't have any results. That's okay. Let's go ahead and do one of the online outreach workers. So this is one of the online outreach workers. They have 33 appointments, 23 arrivals, very proactive. And you can also search by any of the terms used in the token purpose column, token purpose field. So when you enter something that is used among many tokens, it will combine all the results. So when I enter PEL, it'll combine all results of online peer educators. There you have it, 92 bookings, 52 arrived at clinic. And the benefit of this is that you can go to compare, and you can do things like enter the name of the organizations and compare their performance, or even like you see here, Bamako, the name of the district or city. So let's go, so Satora is one. I think OPED is one. Let's just go ahead and see how this looks. That's right. So you can see here the difference between the organizations that are performing on Ibadan. The other item is when clients go to the site, they don't use a token. They even, maybe they learn about QuickRes, they've used it before, and they go back on their own, so they're not remembering to use any token. They fall under direct. So direct or 99999. That's how it gets programmed in the system. And in Mali, they only use tokens. They don't do broad promotions to people. So they're not getting any people under direct. So those are some of the ways you can use the results there. I'm going to go back to the poll results. I don't know, Sarah, if you can bring those up again. I just want to see what were preferred options for demonstrations. Okay, great. So virtual case management was the highest one. We haven't even gotten there yet. So let me go ahead and show that. So as I said, when you have tokens, clients can automatically be assigned to a certain case manager. And that allows the case manager to log in and see all their clients when they book an appointment. And they do that on the program view. So the program view, as seen here, will show all appointments from furthest in the future in green to furthest in the past in white. Yellow are appointments that are booked for today. And you can easily, so this is actually Ibadan. Let's move to QuickRes so you can see your own appointments that you did book. Okay, here we are. So these are the appointments that you booked. I mean, you might recognize some of your names here. Lots of appointments, thank you. There's a lot of appointments on here, this is great. So this is showing you all the appointments for in the future and today. Someone did book for literally every service. Okay, so you can see here, I just want to give you a demonstration of what can be viewed here. I'm logging in as a super admin, so I am able to see the clinic action buttons as well as the case manager buttons. And a program can decide if a case manager on the program side should be the person reporting on behalf of a clinic on Aura. Maybe the clinics actually aren't using it themselves. A case manager can be given privileged access to see that. But as a standard, they don't. As a standard, they only see if the client arrives. And then their options are here, which they can call the client up after they arrived and ask if they were already linked to PrEP or to ART. And they can mark here on their side, just so they know that that was offered to the client during their appointment. They can do the same for ART here. And then once they do mark as initiated on ART or PrEP, it opens up this PrEP clients, ART clients button, which I'll demonstrate in a moment. So this is how they view their clients. They can also search by phone number. I'll give you an example here. So the way that you would do this is you would edit the record, you'd copy the phone number, and then you'd paste it here, and then you'd be able to find all of that client's previous appointments and upcoming appointments based on their phone number. So that you can use that. We'll go back to the original view. And what we have here is, these are all the details for the client's appointment booking. Their name or nickname, the assigned outreach worker, and the assigned case manager. So the outreach worker can see the appointments and they can see if they arrived, and that's it. So basically the outreach worker role is to help a client get in for the services they haven't, or help them rebook an appointment. And rebooking can be done on the back end like this. They can change the clinic, the date, the time. They can add a WhatsApp contact for the client here. And they can reassign to a different outreach worker and reassign to a different case manager. The phone number used for booking, where they receive the SMS, is here. You can see it's hidden, and you hover over to reveal it. The risk is here. So this is the calculated risk value. You have a couple options, a couple of ways to interpret this. If it has 2 dashes, it means they skipped the risk assessment. They didn't do it. What is not presented here is if a member is a key population. What is presented here is a number. This number ranges typically from negative, we believe -5 to +5. If it's a negative number, it represents that the clients that they're HIV negative or they don't know their status. The higher the negative number, meaning like -5, means that they're at higher risk for acquiring HIV or maybe being HIV positive and not knowing, based on the calculation. If it's 0, it could be many things. They could be HIV positive and virally suppressed. They can be HIV negative that have no exposures, or they can be HIV negative and on PrEP, because this is HIV risk, it's not STI risk. If it's a positive number, it means they disclose that they are HIV positive. The higher the number, the higher the risk of onward transmission. So in that case, you might prioritize a couple things. It means the client probably is not virally suppressed, so you prioritize, ART initiation or retention or adherence, and then maybe also index testing to help get their partners in for services as well. Other items here, the new icon shows up when a client says that they were not reached by another organization in the reporting period. So it means for PEPFAR reporting that you're able to say like, oh, this is going to be a new person for my indicators. Let's be sure to bring them in. They haven't been reached by another organization, okay? And the exclamation mark does, and this is the one that I did report on my risk assessment that I experienced rape or sex without my consent is what it says. So any experience of violence has an exclamation point here. And that denotes to the case manager, well, let's follow up and ask, clarify this and see if they needed any assistance. So these are some things that need to be clarified to the client on the consent, the original consent when they tick start, that they are being consented to being followed up by someone, and that some aggregate and some individual risk assessment data is being shared to help them with that follow-up. So countries would need to draft those statements to make sure that it matches. You get the clinic location, the date, the time, the services that were requested for their appointment, and then here, they can start reporting the results. A clinic that logs in, which I'll show you now, they only see appointments like this, which are appointments scheduled for today and in the future. If they want to go back in time, they can, but typically it's what appointments that are for today. The way they use this is they screen a client that arrives. If they booked an appointment on QuickRes, or the client discloses that, and they say, okay, great, this is you. What are the last 4 digits of your phone number? It's 1111. And what's your name you used? Rupert. Great. So they can easily say, this is you, you've arrived, and then they can then provide the services. So Rupert was a home-based services, which means that the clinic might go to the person's house and actually change the date and the time and location where they need them. They agree by phone on those things. Let's say that they had distributed HIV self-test and say, Rupert, we're gonna call you, or you can call us after you do the test, and we'll talk about next steps. They do the call, and or before they call, they say, okay, this was an unassisted kit distribution. We're going to save it, and then when we do the call with him, we're say, okay, it came as reactive. So it's reactive, and you see, as I say reactive, the next logical steps have an alert thing, which means there's something that the clinic should do to really close this case out. So they need to do confirmation testing. Let's say that it was confirmed positive after he came back in and did his HIV testing, and then obviously the next step is ART. So you can say that they are newly initiated on today's date. They're given 90 days of medication. And then of course the next steps are viral load and index. So you have all those there. So this is Rupert. He was booked for tomorrow. And the results are entered here, what was done at the clinic. For case managers, let's go back here and let's look for Rupert. I hope we can search by name as well. We can. So the case manager that's assigned can see this case. Typically, they don't see any of these things other than arrived, all right? But alternatively, you can allow them to see it. For instance, if the case manager is based at a clinic and they, by standard, see this information anyway, you can give them access. What it does show here is that PrEP is not available for offer. So it does say that, follow up them for their ART linkage. The case manager will duplicate enter so that they have it on their side. Yes, they are initiated, okay? And then they can follow up. What this is this is a quarterly entering of ART status, viral load results. And it is refreshed each quarter. So basically at the end of the quarter, you have a month to enter the results of the previous quarter. And after that month, it refreshes for the next quarter. So it's not done live. This is designed to be done more or less reporting, as you do at the end of the quarter, checking on all your clients, see where they're at. And you can say, yes, at the last dispensation in the last quarter, they're given 3 to 5 months ART. And then you can go back and edit for the viral test results if they had done it that quarter. And then you put the date of the actual blood draw. And you can add complex case notes here as much as you like, really, on a bunch of things. So for instance, if clients have a new phone number, or if you need to call a parent's or a partner's phone number or a friend's phone number, then you would put it here and you would note, please confirm identity before discussing details. Things that are more nuanced that aren't available in the reporting buttons, you can add here for clients. And that's how that feature works. Clients that come in routinely can book for refill appointments. So let's go. Okay, so clients that come in, let's say that, are there any ART appointments here? Looks like no one is booking for ART here. So let's say that Sipas has arrived and he's already been enrolled in treatment. So let's just say that he's getting a refill. So you do refill, let's say you got another 90 days. Okay, when you do that, the case manager, it already says that it was a refill and it's locked. It means that you don't need to do long-term reporting on that client. It's not even an option here. What it means is that they should have a previous record of when they were initiated on ART, and that's the record that you do for the long-term reporting. So yeah, that's how the reporting works. That's how the case management works. You have a series of all clients, all their appointments, and then some of them are long-term reporting because some of them are the record at which they initiated treatment or initiated PrEP. And that's the one that you report on each time. Whereas they might have additional records, in the future that are for refills or for routine screening or other services. All right, so let's also go back to, the poll and see if there's any other items that we'd like to demonstrate. So I also like to take another time. I believe we're reaching near the end of our time for the features. So we've got, it looks like 38 minutes left. So that's okay. So we've done the client-led risk assessment. We've not really done the tracked referrals, but we've done the tokens. We've done virtual case management, and we've done the data visualization. So I think the last thing that I can do now is I can show you a little more on the tracked referrals. Okay, so there's a couple of ways this could be done. One, you can create a token for an influencer or a community outreach worker who can use it in their link to allow their followers or their friends to book appointments. And you can attribute the results of that person to the number of bookings and number of arrivals and number of HIV tests that are done. It's actually very easy to do that in the system. Let me give you a quick example. I'm going to use Mali because they have real data. I'm going to go to results. I'm going to go to table. And this is going to allow us to very quickly show you how we can attribute results to individual people, because each of these tokens are for individual outreach workers. And they don't need to be outreach workers. They can be a influencer or another method. So you can see here, the first three are really active. These aren't really using the system yet. You have a number of risk assessments, appointments, and you can compare even HIV case finding here between the different staff. So that's showing you how you can attribute results to individual people based on the referrals. Some more complex referral options are, once a client is in your system, you can offer them the ability to refer others. Let's go to QuickRes to show you how that's done. So the best example, the easiest example is index testing. So what you have here are your clients, and let's go to one where we should offer index. So Rupert. So let's say that he's interested in referring his partners. This can be selected, and it can be selected by the clinic staff, or it can be selected by the case manager. Okay. So let's go ahead and show you these options. So what this allows the program to do is to offer a couple methods for tracked referral for partners to come in for testing. Between a positive seed, actually these don't need to be used for HIV positive clients only. They can be used for any clients. As you can see, it's available on all of them. The first method is provider-led, which this means it's going to open up, sorry, it's going to open up this page which allows the provider to enter the mobile number of each of the partners. Okay, so this means that the provider already has a protocol for interacting with the index client, introducing index testing process to them, saying that the provider will record each of these phone numbers of their partners. They might contact or call these clients beforehand, explain their normal protocol for index testing and the normal notification service that they provide, and say, all right, in a moment after my phone call, I'm going to send you a SMS with a link to book an appointment on QuickRes. Please click the link and book for HIV testing. And it allows them to book at any clinic on QuickRes. So you can see here, I'm selecting HIV as the possible exposure. And here is a draft of the actual message that is sent to that client. And as you can see, in the link, it is tracked to the original person. It first uses this token, 201855. 201 is the country code. 855 is the refer a friend or the index testing code. So that's what it's referring to. And then it has this code. This code is the referring client's reservation code in Aura. So it's anonymous. You can't use this to, no one outside the program can use this to identify the referring partner. It's anonymous. It receives, these messages are received by these phone numbers, and they don't know who is the index case. So when you see send, it'll send these messages to these individually from QuickRes. Okay, that's provider. That's provider-led. The other option is client-led. What this will do is it'll send a link to the client for them to forward to their friends. So that's not the same feature. Basically, it says here's a link with a tracked code. You can not anonymously, send this, forward it to your friends for them to book appointments. This is if the client themselves wants to, talk to their partners about it and then share with them the link. It doesn't need to be anonymous. The last method is an anonymous method where when you click it, it sends the link to this page to the client to do on their own. So they can go on, they can enter the mobile number of the partners, they can hit send. That's currently how it functions. Of course, the HIV program can decide whether that's going to be appropriate, and they can also decide on what the message text should say. But those are the options. All right, so I'm going to end the demos there. I believe there's probably a bunch of questions coming in the chat. I'm not able to review all of them live, but I do know that if you use a Q&A feature at the top, our moderators can address those questions. So let's go back to the PowerPoint. Sarah, let's go back to that PowerPoint. Great. So we do have some time for Q&A. What I can do is actually open up to our moderators to see if there's any particular questions they'd like to address live. So Purvi, Shanti, Abraham, Eric, if you can unmute and just let us know if there's any questions you're seeing that are coming in that you think we should address live.
Hi, Ben. So most of the questions have been answered in the chat as well as the Q&A section, but there are a few that just come in, and maybe we can do that live. So one of the questions is that, does the referring partner then need to go on QuickRes?
Yes. Yes, I mean, Purvi, you know this as well. Yes, it's true. The way that the referrals, the index testing works on QuickRes is you need to do at least a couple things. One, you need tokens to be able to track the index. And then you need the original client to have been booked on QuickRes and have their results reported, results for HTTP testing. And then from there, you need the next client who's then sent the link to go back on the QuickRes, book an appointment, and you need that client's results to also be reported. And that's going to allow you to have sort of the full cascade of the index clients from referral to uptake to results.
Okay, and another question is, what if the client does not have a smartphone? So here, I mean, if the client does not have the smartphone, then, you know, the community outreach worker or someone can help the client in booking an appointment and getting through the process. But that's the simplest way that we can do it.
That's right.
How does the government adopt this?
What's the question?
How does a government adopt this?
Yes, that's a great question. Well, I think the government, I mean, we'll actually in the next section, we will review how to join QuickRes and considerations for joining. Those considerations are tailored more for HTTP programs, maybe implementing partners, and maybe a little bit less for governments, but I think they still hold true. So we'll get into that. And if you need more information, we can address it at that time.
And Peter, your other question about the community-based organizations participating on QuickRes will be addressed in the next section as mentioned by Ben.
Eric, Abraham, or Shanti, were there any other questions that came up or things you think we should address now so people have a good grasp of the functions before we move forward? Okay.
There's a question on pricing, Ben. You're going to address that in the next section, right? The pricing bit.
The pricing bit is included in the next section, that's right. And of course, the webinar is recorded, so it will be shared to the same listserv where this was announced. The recording will be shared. Okay, great. So let's move ahead. And of course, you can view the Q&A function to see other people's questions and our responses. So joining QuickRes. I'm just going to pull to that on my screen as well. We'll go to the next slide. So we're going to do a poll again, and this is really to just assess what you, now that you understand the functions, where are you sitting on this? Of course, this is a time where we're trying to help programs understand if QuickRes is right for them, but also if it could be used for other purposes. You know, they can learn about it and use it in their own program in a different way. So let's go ahead and think of your own response. So this is personally, you're not responding on behalf of your organization, just personally, what do you think about joining QuickRes? Your current gut reaction, just to help us guide the next steps in the discussion. So go ahead and give your response. You can say, oh, I realize that's not right for my project, or oh, I am still considering, I don't know if it's right or not. Or yes, I want to join, but I don't know how. The last option is, I already have plans to join. So you've already made your decision. So go ahead and give your options, give your responses there, and it'll help us go to the next steps. And there's no wrong answer, of course. All right, so I think we have enough time for the poll. Let's go ahead and reveal the results. Okay, great. Some people already know that it's not right for their project. And in that case, we will be going into a section that is really about how to join. So at this point, you realize it's really not right for you. You don't need to continue on the webinar. You can easily just join, drop off, or you can stay on if it's just interesting for you, but you know it's not right for your project. That's also okay. If you're still considering, maybe the next section will help you because we'll get into budgeting and other considerations for deciding to use QuickRes. That's great. If you want to join and don't know how, great. We're going to be reviewing exactly the process of how to join. There are some nuances. We haven't identified all the methods of actually joining. For instance, if you're a government partner, we don't have everything mapped out yet, but we have some things to consider. And if you're already planning to join, great. You're in the right place. You've learned a lot already, and you'll get some more information coming up soon. All right, we'll go to the next slide. So HTTP programs will need to consider their needs, the platform functions, the technology requirements, and budget inputs to determine if QuickRes is right for them. Go to the next slide. And there are some important things to consider. One are the functions that your program will want to leverage on Aura. And while some functions are seen as more fundamental than others, as you see here, level 1, 2, 3, 4, it's possible to skip some levels or use a mixed approach. And we'll give some examples of exactly how countries are doing this. So go to the next slide. So as an example, the EPIC project in Liberia is interested to use QuickRes really for index testing. So they want to allow clinics to offer partner referral options to clients through the provider facilitated or anonymous client methods on Aura that I just showed you. So that's one method. They also might have a separate team of outreach workers that are already starting to reach their beneficiaries and clients online, particularly MSM and transgender, who may have been unwilling to meet at project sites are now unable because of COVID. So they want to use Aura for that. So that means they're going to be using it for a segment of their clients that they're reaching. And also all clients that book an appointment on Aura are sent a link after their appointment to an online survey to provide feedback. So they're going to be collecting client feedback on that system as well. Go to the next slide. And I'll have Purvi unmute and share the example from Lesotho.
Okay, actually, Lesotho had recently, when we started the program, they mentioned about having issues with reaching out to young and older MSMs through their current program. And they started reaching out to populations on social media platforms and dating apps last year, sometime near December. And they've had excellent results so far. So one of the months I remember, there were around 38 people tested, out of which around 21 were HIV positive. So the case detection among MSM really went up. That means that we were reaching the right populations through online interventions. But what lacked was a robust case management system. And it is also one of the few countries which will have a lot of clinics and facilities added on to QuickRes, including private clinics. The QuickRes platform will bring the beneficiaries as well as these stakeholders on a unified system to reach, link, and track for anonymous and confidential service delivery.
Great. So we'll go to the next slide. So Shanti, if you're on the call and you can unmute, you can give a description of how DRC will be using QuickRes.
Yes, so in the DRC, they're looking at using QuickRes among 3 populations. That includes the female sex workers and their clients, as well as MSM. And they're looking at including 4 of the community-based clinics that they support, largely for taking the risk assessments and booking appointments. And their plan is to really roll this out and link it with some of the other projects that are working within the same communities that are providing some more of the clinical services.
Great. We'll go to the next slide. And Abraham, if you're able to unmute and give a description of how Guyana is interested to use QuickRes.
Right, thanks, Ben. So the partners in Guyana are new to QuickRes. So as you're doing this webinar, they're slowly being onboarded. Some of their clinics have already been listed. The partners will be primarily using QuickRes because of the benefits it have in this period of the COVID-19 pandemic, and as well as the benefits that it will have post-pandemic. So clients will essentially be able to go online, make the reservations for HIV or STI services, as well as support services. The partners are especially interested in the options that will allow clients to engage with clients in chats, for example, on WhatsApp or on Facebook Messenger. But QuickRes will importantly strengthen routing, monitoring, and reporting as clients are being enrolled in key HIV services.
Great. Well, thank you for those examples, team. We'll just go to the next slide. And I wanted to mention again that there is a difference between QuickRes and Aura, and especially for rollout. So QuickRes is a cross-country platform. It is shared across countries. And because it's shared, there's some things that are standard and can't be changed. And on Aura, it is country specific, which means that you can have more tailored features, you can have customizations that some things on QuickRes can't accommodate for. On QuickRes, it is hosted in one place, on one server, one cloud server. A very secure server hosting, but it is in one place. And it's also one website. So everyone accesses it at quickres.org. Whereas on Aura, you can host it anywhere. You can host it in country. Some countries like to have things hosted in a local server. You can do that with Aura. And you can have it on your own website. You can name your website however you want. Also it's on QuickRes, the data is hosted in one place on a server managed by FHI 360. So that's something to consider. It does have partitioned data access, meaning that programs can access data of other programs on the system. But on Aura, it can be really your own platform where you decide who gets access, meaning that it can be owned completely by a local organization. FHI 360 can be does not have access to that data if no technical assistance or support is needed from FHI 360. So on QuickRes, there are standard functions. A lot of things can't be changed because if it's changed on one country, it impacts all the others. However, on Aura, you can customize those things. For instance, if you want to customize the risk result pages, you should do that on Aura. So on QuickRes, currently there's no data integration, such as like data sharing with a national system or data sharing with an existing electronic medical record system. And with Aura, it might be easier to set those things up because it is your own platform. It is one database that is for your data, okay? We already talked about the branding. If it's on QuickRes, it really does have pretty standard branding. There's a couple things you can customize by country, such as the welcome text that is used at the very beginning of the home page. But the website stays the same, the main logo stays the same, etc. Some main differences. QuickRes is a lot cheaper and a lot faster because you don't need to pay for development of your own Aura platform. You don't need to pay for hosting. It's basically already covered. It's faster as well because there's a huge backlog of countries that want their own Aura, and QuickRes is online and available, and countries can log in and add their clinics and start using it as long as they have the capacity. Aura can be more costly and more timely. So for Aura, we are looking at September or later for new countries that haven't already expressed interest to be able to get their own platform. It just takes more time, and there's more setup steps because there's more customizations. We'll go to the next slide. So here are some examples of when QuickRes is a good idea and when it's not a good idea. So what we found is that QuickRes is really great for private sector service delivery partnerships. It's been used in India that way with chains of private laboratories. It's being used in Jamaica for a new network of private HIV service providers, physicians. And it's great because we're not coming to them with a bunch of paper forms that we're asking them to fill out. It's a simple appointment booking system that can be even very useful for them when they're engaging with their clients, and they simply click a few buttons, and that's the end of the day. That's the end of their reporting. We're not requiring them necessarily to do anything additional. So we found that this is a great way to engage the private sector in our program. You just merely need to set up a data sharing agreement, an MOU, and training for them on how to use the system. Also, when there are new programs that are being rolled out that don't have existing systems, maybe you have limitations on using DHIS2 or other tracker tools, and Aura is seen as a convenient or easy solution. This might be useful. We've also found it very useful for key population HIV programs that have a lot of community outreach workers or community services, because sometimes those services aren't completely integrated into the national system because of confidentiality, data security. Sometimes we don't know exactly what the governments would do with some data. So if it's in the hands of the community, this can be something that they can use. And also for existing CSOs, community service organizations, that want to shift from the paper tools to something online. And that's an example of what's being done in Guyana. Another item is, for instance, if you have an HIV program that's like, shoot, we've been missing a whole group of people that are online, but they're quite different than our existing beneficiaries. So maybe the existing beneficiaries, they continue to engage in HIV services through the existing clinics with their own paper forms, and you don't want to change that. That's okay. And then you could use Aura to do a new online campaign for new target audiences, new socioeconomic groups, and Aura might be really well suited for that audience. And you can use it for that purpose. Some things that might make it less useful is when you're using QuickRes in addition to another system for reporting. It can be double entry, and providers might not like that as much. If you need to integrate with another system, such as a medical record system, data sharing, QuickRes might not be the best option for you. You might go for your own Aura. If you need the data on QuickRes to be stored locally, that might be hard on QuickRes, so you might use your own Aura. And if partners want a lot of features customized, you might use your own Aura. Some things that might lead you to avoid using QuickRes or even Aura as well is if there are existing client management systems that are not really limiting your program performance, that are already working quite well. There's no reason to duplicate that. Or if your program doesn't really meet the standard requirements for QuickRes, which we'll review on the next few slides. If data sharing with government is mandatory or local ownership is required, you might use your own Aura. But if any of this data on QuickRes or Aura can put beneficiaries at risk by even having the data available in any format, then this might not be the right solution for you. So go to the next slide. So here are some limitations with QuickRes, okay? We've already reviewed some of these. It's a single website, quickres.org. You can't really change that. The risk assessment is standard. The list of available services that clinics can choose that say that they offer and for clients to be able to book for is set. If you add a new service, it's added for all countries, which is possible, but currently it's a set list. The reporting buttons for clinic staff and for case managers are also set, and those disaggregations are also set. The data is hosted in a cloud server, not in country. QuickRes is managed by FHI 360, and because the project funds come from USA and PEPFAR, they're the real owner. There are some limitations for languages. The backend can accommodate for 3 languages. So we're proposing English, French, and Spanish. That's for backend users that log in. And each country can have their own 2 front-facing languages. So for instance, Thailand can have English and Thai. Mali can have French and Bambara. And each country can have those programs separately. So some of the minimum requirements, go to the next slide. Clients should have a basic phone because they need to receive the SMS and be able to be called for follow-up. If they are going to be booking services on their own, they need a smartphone with mobile data. Outreach workers and case managers should have a smartphone or a tablet, especially if they're going to be logging in and reporting results or viewing their cohort of clients. It's nice to have it on a tablet. Clinic staff, if they're going to be doing the reporting, should be equipped with a tablet or laptop with mobile data to report client arrivals and services provided. Programs should also budget for technical assistance for rollout. There are some things that are really important to have as part of the rollout, and TA is something that would help ensure that those are done to quality. And some sort of data sharing or confidentiality agreement with FHI 360, which is the owner or the host of the global QuickRes platform. We'll go to the next slide. So these are some budgeting inputs, and these are samples. Some things are suggested, and some things are pretty firm. So technical assistance, this is recommendations for setup, rollout, and routine implementation support that lasts an entire year. This is something we do recommend for countries that are new to QuickRes, just because it does take some time and effort to be able to implement with quality. And so we've estimated around 20,000 to do that support for a year. And I think that's around, an entire month of LOE that can be spread out across the year. Some technology costs also apply. You will contribute a certain amount to the SMS bundle that's shared across country. So typically we would recommend maybe 300 to 400, but it entirely depends on the volume of clients that are interacting on your system that determines how much you should purchase. You would also have a developer service contract that can be shared across countries. It may not be 1,000, it might be less because you're sharing it. So whenever you have issues on the system, it can be supported by a developer to make the changes and edit any errors that are occurring. If you're using Aura, there are additional technology costs. Some things that your own program would have to consider when budgeting is your own marketing budget. Like, how are you going to get clients to even know about this platform? If you're reaching new audiences online, you might have ads, influencers to drive traffic to QuickRes. You might also need to purchase new devices and mobile data or airtime for clinic staff, case managers, and maybe outreach workers. And then on the implementation side, you might have some staff or consultants that help you do the rollout and translate any documents and or support implementation, routine implementation from the field level. Next slide. So setup and rollout steps. It looks like we have 10 more minutes remaining, and that's really perfect timing. So for QuickRes, there's 15 setup steps, or has more steps. And then there's 10 rollout steps that apply to both if you use QuickRes or Aura. So go to the next slide. These are some of the setup steps, the inputs that are required to really customize your version of QuickRes. So first you need to decide what platform you want to use. You get a point of contact on your organization side that can provide all these inputs. There's some sort of scoping meeting, it could be virtual or in person, with the country team to define exactly how they want to use Aura or QuickRes and make sure that it's the right fit for them. They'll be also ensuring that the data systems on QuickRes are coordinated with other reporting systems. So that might mean making decisions around what data is going to be relied upon from within QuickRes for reporting or what's not. Or if you're just going to use QuickRes to visualize the result of an online campaign, but still it's all collected and reported on paper forms when they get to the clinic, you just need to make those decisions from an early stage. Budgeting for technical assistance once you have your plan together, procuring SMS, choosing your languages, translating those languages. You might add a social tag. And what that is like a tag from an online advertising platform that allows you to sort of track the results of online ads. It's not required, it's something you can do. And it allows you to target ads again to people who had landed on the site and started an interaction on the site. So I'm sure you've seen sometime before when you're on Instagram and you get an ad, you go to the website and you don't buy anything, but you just look at their products. And then you get that ad a million more times. That's because they're using a social tag on their site. It's tracking you back to the social platform and re-advertising the same service. It's actually very effective for supporting uptake of services. You'll also need to decide on what accounts to link to your QuickRes for client support. So you can add a WhatsApp link and a Facebook chat link. And there's a couple other items here that are just specific to your country's version of QuickRes. Okay, we'll go to the next slide. These are the rollout steps, and these are kind of done in conjunction with the setup steps. You'll draft a description of how your program wants to use QuickRes. You'll decide on what services and clinics will be offered. You'll decide who will have login access to QuickRes. And then you'll begin to develop your SOPs, your standard operating procedures for each of the users on QuickRes. Who does what, when, what are their permissions, etc. You'll then go in and you'll add your clinics and your users to QuickRes. You can add your translations. You can then do your training with the users and your SOPs that you've developed. After the training, you'll delete all your dummy data. You'll start your soft launch, and you can continue user testing and feedback and scale up. All right, we'll go to the next slide. So this is a moment for you to ask any questions in the Q&A about QuickRes startup, and we can address those. And we're just now going to consider some next steps for us. So we'll go to the next slide. And we're going to do a poll. I just want to hear very quickly what you think are the features on QuickRes that you are most interested to use in your HEB program. So we'll go ahead and you've seen most of these features here. Track referrals does include index. Go ahead and just give your idea of what you find most valuable for your program, and it'll help us get a sense of where people land. So go ahead and respond on the poll. We have 55 people on the call still, so that should be some interesting data to review here. All right, I think that's probably enough time. Sarah, why don't you go ahead and reveal? Okay, great. Virtual case management. That's really a really strong use case. I will give an example. If you're thinking of using this not for clinics to report services provided to clients during appointment, and if you're thinking maybe we won't use this for appointments, that's fine. What you can do is you can have maybe your outreach team that already has their cohort of clients that they reach every quarter, every month, and they can book an appointment for them on QuickRes under a service called Call Me Back. And it's not in a normal clinic. It's its own thing. And that means that the case can be assigned to the outreach worker. They can see all their clients, and they can follow up with them over time to actually help them access services. They can use the case notes section as well. You can also upload all of your existing treatment clients, ART or PrEP, onto the system. You book them an appointment, you go and you see that they're assigned to you as a case manager, and then you actually edit the appointment record to be the day, time, and clinic of when they actually enrolled originally in treatment. You put the date of initiation, and then automatically you have your list of clients that are assigned to you for ART case management, and then you can report on their retention each quarter on the system. And it's not like, and because you changed the appointment to be in the past, no one's going to be saying that the client arrived at the clinic. It's just used to load them on the system so that they can be there, and then you can continue with your case management there. So that's how you can do some, but not all of the features on Aura. And also I see that very popular is to do the actual appointment booking, risk assessment, and track referrals. That makes a lot of sense. Okay, next slide. And we'll do another poll. Okay, so this is just to gauge where you're at currently. And so you can respond, again, not on behalf of your HV program, but personally, just what do you think? Do you think that QuickRes will be useful for your HV program? And you can give your response about how you're feeling currently. Yes, we can implement fully. Yes, but maybe you don't meet all the requirements. It could be the budget issue, or you can't get tablets, or another item. Somewhat, we can use this in combination with another system, or somewhat, we'll actually learn from what we said today and we'll improve our existing system or another system. Or no, it completely duplicates the existing system, it's not very useful. Or no, it doesn't actually meet any of our current needs. So feel free to respond. Any response is going to be totally fine. It just helps us to know where people are at. So go ahead, you can give your response about how you're feeling. I'll just give it a moment. And I think, Sarah, we can go ahead and reveal the results. Okay, great. This is really useful. Okay, so generally it looks like it does meet some needs. There's some duplication. I am really happy to hear that what you've learned today can be useful in your existing system, because there's lots of things here that are quite new and aren't being used in other tracker systems or case management systems. So very helpful that this can be useful for you. If it can be used in combination with another system, it does take some nuanced understanding of both systems to have a really good combined approach. And it might mean that you don't use all the features of QuickRes. You just use some of them, the ones that you need, and that's totally okay. I see that many people are interested, but they don't meet all the requirements. So if you are concerned or want to have more details about how you can try to meet the requirements, you can send us an email. I'll show it on the next slide shortly, how you can reach out to us and see how this can work for you. As some examples, the easiest ways to engage in QuickRes is if you are an existing FHI 360 HEV program, you can include it in your budget, and it's very easy to receive the TA and to have this support be provided. If you're at a different organization, sometimes a new project buy-in can be done through the global linkages or EPIC projects, and that's done through a USAID mission, and they can support you to having this as part of your scope. If there are other projects not supported through a USAID mission, or not through the EPIC or linkages global projects, such as Global Fund supported projects, it might be possible to have this be a part of their budget, and they can just have a contract for technical assistance from FHI 360, and the specific costs for technology and rollout can be supported by the individual organization on the ground. So those are some options, some things to consider. Please, we'll go to the next slide. And this is just a time for additional open Q&A, and we can do our closing. We just have like a minute more, so let me go ahead and ask if Eric, Purvi, Shanti, Abraham, if there's any questions about rollout that you think we should address with the group. Nope. Okay. Purvi, was there anything that you saw from your side?
Nope, I managed to address most of them. I don't think
Okay.
I've left.
Okay, great. So go ahead and check the Q&A with the responses there. And what we'll do, we can go to the next slide, is you can find a lot of these related resources here. There is a QuickRes technical guide published yesterday, and it does detail most of what we reviewed today. And you can find it by going on our website here. Additional resources is there's the Aura V3 technical brief, and there's a Going Online vision and other related Going Online documents all at the link. You can always try out the site again, quickres.org/100. That'll send you to the test country. And you can contact us. I see that there's an error in the email. It's goingonline@fhi360.org. And you can engage us to talk about startup, considering QuickRes, or if you have any other questions or information. So go to the next slide. Yep, so thank you for your time. I'd like to highlight our great team who contributed to the development of many of these approaches and QuickRes and helped pull together this presentation. Feel free to reach out to us by email. And also you can join a WhatsApp group that is a global Going Online WhatsApp group, public. And you can click that link to join that group. What I'll do also is I will send the link in the chat and you can join on WhatsApp there. And that's where we discuss all these and related approaches. Also not shown on this slide, we have Abraham and Shanti who are helping us and are members of our team as well. So thank you so much for your time. We'll be sending out the recording and related resources by email on the Epic newsletter broadcast, or you will be able to see it on the WhatsApp chat if you join. Thank you so much for your time and enjoy the rest of your day. Be sure to reach out if you have any questions or need support. Thank you.